My name is Dr. Jay Akaf. I'm a certified periodontist. On this segment, I'm going to talk about recession around the teeth, recession of the gum around the teeth. Now, how do we treat them and what causes recession? Now, the areas that have recessions could be because of the way you brush. If you brush your teeth on a back and forth motion, you could cause recession of the gum. Sometimes you go through braces and the teeth are getting moved rapidly or moved away from where the bone is, and you get recessions. So we have to fix those or repair them so that they don't cause any problem and you don't show the root surfaces that can cause decay on the root surfaces because of not being covered, and less support for the area is present because of the gum recession. Now, there are three different ways we could cover the root surfaces. One is the older method that we use, which we take pieces of tissue from the roof of the mouth or the back portion of the back tooth on the upper, which are thick tissue. We take those pieces of tissue and we literally, like on this case here, I can show it to you on this computer here. This person has got recession on the canine, and we take the pieces of tissue from the roof of the mouth and prepare this area and literally graft it on there after we're preparing the root surfaces, and we literally suture it on. However, this method, it's a little bit on the sore side. It's like a big pizza burn because we take the piece from the roof of the mouth, and once you do that, it's like a big pizza burn. Now, it will work really well. However, the color of the tissue may not be the same. So on the aesthetic areas, we rather use different methods. Now, what do we do on different methods? The other method is that I can literally take the pieces of tissue that's above the area that's receded, undermine it, and move it further down, and we put a collagen membrane underneath that, so we will cover the root surfaces, we will regenerate the bone, and be the same color as the adjacent teeth. Now, the third method, which is a newer method, is called pinhole surgical technique. On this method, it's a little bit less aggressive. There's not, the suturing is not involved. There's not any sort of cutting involved most of the time. What we would do, if I can show it to you on this model here, we will put small holes, about 4 holes, really small holes, size of a needle. And through those holes, what we would do, we undermine the tissue and lift it up. Once we lifted it up, what we would do, we will pack collagen membrane on those areas and cover the receded part through the tunneling of that area. And the tissue gets lifted up and it stays there. And once it heals, now the receded areas are covered. So those are the three techniques of covering the recessions.